Pendulation is a term coined by Dr. Peter Levine, who is the creator of somatic experience therapy, which is a therapy for trauma and chronic conditions. Hi, I'm Michael Westgate. Thank you for joining me. I've helped people with chronic pain for over 2 decades. I aim to help you say goodbye to pain and hello to a fully lived life. I want to remind you that when your body is overwhelmed or in pain, that you and we all tend to disconnect from it because we see the body as the source of pain. And therefore we reject it and we abandon it because we want to get away from the pain. So now we're going to do a pendulation exercise to relieve pain. So here's the preparation. Again, you want to find a quiet space. You want an environment where you won't be disturbed. So if in all these exercises, it's best to let everyone know not to come bursting into the room. If you have pets, please put them out of the room so they don't interrupt you. Unless you need them to feel regulated, in that case, it's fine. But generally speaking, it's better if you're on your own. If you have someone else in the room to help you feel secure, just make sure that there's no talking or interruption for your practice. So you want to comfortably sit or lie down and allow your body to relax. So if you're in a chair, just kind of sink into the chair. And if you're in a bed or on a mat, then let yourself just kind of sink into the mat. We're going to start by exploring sensations in the body. Begin by focusing on your breath. Take a few deep breaths to center yourself and bring your attention to the present moment. Then scan your body. Explore your body for areas of comfort and ease. So those are areas that feel warm, at ease, and happy, relaxed. And then explore your body for areas of discomfort or pain. And the sensations in both of these cases could be quite varied. So for pain, it could be a sharp, it could be hot, or too cold, or tense and gripped. Doesn't really matter as long as it's something that you feel uncomfortable with. And just note the areas in your body that feel uncomfortable and the ones that feel comfortable. It's important to pay attention to the qualities of the sensation in both of these because it helps your nervous system when you can name it. So you might even say to yourself, this area of my body feels numb. This other area of my body feels prickly or throbbing. And then likewise, you go, this area of my body feels light, or it's floating or warm. See if you can do that. You're going to see if you can label both areas of comfort and ease and areas of discomfort or pain. Now, what I want you to do is lightly assess the intensity of discomfort or pain on a 1 to 10 scale, and 10 being the most intense. Now that you've identified some areas, I want you to choose an area of discomfort or pain that is moderate in intensity. So do not choose the one that's the worst. Choose one that is in the middle ground. You're going to use this when we do the pendulation exercise. So now direct your attention to the chosen area of discomfort or pain and observe it without judgment. Pay attention to the qualities of the sensation. Is it sharp, dull, throbbing, or burning? Describe it to yourself. Keep breathing. Continue to breathe slowly and deeply. Avoid holding your breath, even if the sensation is intense, and don't force it. Now, when the sensation becomes overwhelming or too intense, redirect your attention to the area of comfort that you identified earlier. It could be any of them. It could even be a neutral area, as long as it's an area that isn't in distress. As you shift your focus to comfort, notice how the sensations in your body change. And again, do your best to name specifically what that area feels like. It's warm, it's relaxed, Or you can even say it's neutral, so it's just kind of quiet. Now that you've spent a little bit of time with the positive sensations, practice moving back and forth between the contraction of painful area sensations and expansion, the comforting area, and their sensations. You have to trust the rhythm. Allow this kind of oscillation, this pendulation, to kind of proceed naturally. Trust your body's innate sense of when to move between the different areas. As you observe this pendulation between the two areas, notice any changes in the intensity or qualities of the painful sensations. The pain may begin to soften as you shift back and forth. So keep practicing. You're going to go at your own pace. Spend as much time as necessary in the at ease area so that when you come back to the place of pain, that you feel like you have more grounding and more resources. So as you pendulate, you're facilitating the gradual release of trapped energy and emotional tension associated with that pain. And remember that over time, you may achieve a better sense of balance and regulation in your body, which will aid your healing if you do this regularly. All right, now I want you to come back to the sensation of ease and sit with that. So just sit with the sensation of ease and kind of try to go deeper into that space. And then go back to the place of pain and see if it feels any different than it did when you started. And if so, see if you can name it. It used to feel prickly, now it feels just achy. Or maybe it's slightly numb, but there's no prickle. Or maybe it's even warm now and a little more at ease. Whatever is real for you. Then, following your breath, if you've closed your eyes, slowly open them and kind of feel yourself in your chair. Reorient to the space you're in when it's appropriate for you to do so. This exercise will build resilience in your nervous system. And I want you to consider incorporating pendulation into your self-care routine to strengthen your nervous system and to up the capacity to handle difficult emotions and painful situations. What's extremely important to this process is self-compassion and patience. Healing is a journey. It's okay that it takes time. And this is a great thing to use when you feel overwhelmed by a circumstance or some sort of event. If you can find some quiet time, you can lock yourself in the broom closet for 10 minutes. This would be a great place to go to help you with that overwhelm. If you found this content helpful, please like and subscribe. You can look forward to more videos about how to overcome chronic illness and chronic pain.